Good day! Welcome to our learning session, and today we'll talk about how to interpret arterial blood gas the easy way. So let's talk about how to interpret ABG the easy way. Let's have a bit of a background. Arterial blood gas, or ABG, is a test involving the collection of arterial blood from the radial, femoral, or brachial arteries. It is used to detect the presence of acid-base imbalance in the body. So let's begin with the functional concept. ABGs are drawn to check for, remember, this code: chemical poisoning, overdose of drugs, lung failure, dehydration, shock, trauma, uncontrolled diabetes mellitus, chronic obstructive pulmonary disease, and kidney failure. So remember the code: cold stroke. Now there are 5 components of arterial blood gas, and we have pH, or the power of hydrogen. The normal value is 7.35 to 7.45. The partial pressure of oxygen, normal value is 75 to 100 millimeters mercury. The partial pressure of carbon dioxide, normal value is 35 to 45 millimeters mercury. Bicarbonate, normal value is 22 to 26 milliequivalent per liter. And oxygen saturation, in which a normal value is from 94 to 100%. Now pay particular attention that the first step is for you to determine the normal values of each of these components. And take note that these values are the ones that are based on the values given by the National Institute of Health. Let's proceed with another functional concept. Remember, initially, check the pH to determine the presence of an acid-base imbalance. Carbon dioxide is the respiratory component of the blood gas. Therefore, we bring those two concepts together and we say, check the pH and the partial arterial pressure of carbon dioxide to identify respiratory acid-base imbalance. A respiratory acid-base imbalance, therefore, is represented by an alteration in the pH, which normal value is 7.35 to 7.45, and the pressure, partial pressure of carbon dioxide, its normal value is 35 to 45 millimeters mercury. Therefore, we could honestly say that when you have a respiratory acid-base imbalance, therefore we can say that we have a respiratory acid-base imbalance leading to alkalosis when the pH is up and the pressure of carbon dioxide is down. The opposite occurs in an acidotic state in which the pH is down and the pressure of carbon dioxide is up. Let's proceed with another functional concept. Bicarbonate is the metabolic component of the blood gas. Therefore, you need to check the pH and the bicarbonate to identify metabolic acid-base imbalance. And we say a metabolic acid-base imbalance is represented by an imbalance in pH, which normal value is 7.35 to 7.45, and bicarbonate, which normal value is 22 to 26 milliequivalent per liter. Therefore, metabolic acid-base imbalances result to alkalosis when both the pH and the bicarb are elevated, and it results to acidosis when both the pH and the bicarb are decreased. Now, let's focus on the method that simplifies all the basic concepts we have learned so far, and I call it the RAS method. It's actually another code. Now remember this: respiratory imbalances are characterized by alternate direction of the pH and the pressure of carbon dioxide, while metabolic imbalances are characterized by same direction of the pH and the bicarb. So let's illustrate. In respiratory imbalances, the pH and the pressure of carbon dioxide are always in alternate direction. In an alkalotic state, the pH is increased while the carbon dioxide is decreased. In an acidotic state, the pH is decreased and the carbon dioxide is increased. Now, let's take a look at what happens in metabolic imbalances. In an alkalotic state, both the pH and the bicarb are in the same direction. They're both elevated, whereas in an acidotic state, the pH and the bicarb are also in the same direction. They're both down. So once again, to summarize, remember RAMs. In respiratory imbalances, there is an alternate direction of the arrows of the pH and the carbon dioxide, whereas in metabolic imbalances, there is the same direction of the arrows relating to the pH as well as the bicarb. So remember, when everything, meaning the pH, the bicarb, and the carbon dioxide is low, consider metabolic acidosis. When everything, meaning the pH, the bicarb, and the carbon dioxide is high, consider metabolic alkalosis. Let's try answering a question. The arterial blood gas results of a client are as follows. pH is low, CO2 is low, and the bicarb is low. The nurse notes that the condition is, okay, if we're going to recall what we have learned a while back, we just said that when everything is low, consider metabolic acidosis. So let's summarize. In alkalosis, the pH and the bicarbonate are both elevated, whereas the carbon dioxide is decreased. In an acidotic state, the pH and the bicarb are both decreased or down, and the carbon dioxide is up. So let's try answering a question. ABG results of a client with asthma are as follows. pH 7.28, carbon dioxide 50, pressure of oxygen 70. Now, the first step that we have to do is to classify whether the value is elevated or decreased. So the normal pH is 7.35 to 7.45. So this is definitely down. CO2, the normal is 35 to 45. So this is definitely up. So there's alternate direction of the arrows of the two main components. Therefore, we only think of a respiratory disorder. And since the pH is low, then we consider this as respiratory acidosis. So remember, any condition that slows breathing leads to respiratory acidosis. And any condition that increases breathing leads to respiratory alkalosis. Let's have some mind exercises. Given a condition, identify the associated acid-base imbalance. Let's begin. And let's try. Suppose you have a condition, anxiety. So what happens in anxiety? What results from anxiety? The answer, respiratory alkalosis. Why? Anxiety causes the respiratory rate to increase, leading to loss of carbon dioxide. This causes the pH to go up, resulting to alkalosis. So if your patient is in panic or is having some nervousness, they need to actually take a deep breath and then eventually relax. Otherwise, if they continue to breathe rapidly, this results to alkalosis. Next condition is aspirin toxicity early stage. This results to respiratory alkalosis. Let me tell you why. Now remember, the therapeutic range of salicylate concentration for its anti-inflammatory effect is actually 15 to 30 milligrams per deciliter. Now when does toxicity occur? It occurs when the concentration goes higher than 30 milligrams per deciliter. Aspirin stimulates the respiratory center in the brain, increasing breathing. And as we said a while back, an increase in breathing leads to loss of carbon dioxide. This causes the pH to go up, resulting to alkalosis. That's why in early stage aspirin toxicity, respiratory alkalosis results. Now let's have another condition. What about when you have aspirin toxicity late stage? This results to no longer respiratory alkalosis, but metabolic acidosis. Why? Now, aspirin is usually converted to salicylic acid. Metabolic processes resulting from this includes accumulation of lactic acid and pyruvic acid. This results to metabolic acidosis. So in late-stage aspirin toxicity, there's an accumulation of various types of acids in the body. That leads to metabolic acidosis. Now let's have another condition. What about vomiting? This results to metabolic alkalosis. Again, why? Excessive vomiting leads to loss of acid and electrolytes like potassium through the gastrointestinal tract. Now, this leads to metabolic alkalosis. Let's have another condition. What about diarrhea? This leads to metabolic acidosis. Why? Diarrhea leads to the loss of bicarb, resulting to the kidney's reabsorption of chloride instead of the bicarbonates. Therefore, the reabsorption of chloride results to hyperchloremic acidosis. Now let's master. Let's try to match the conditions under the first column on the left to the imbalance associated with the conditions to the column on the right. So if you talk about Cushing's disease, what usually results when you have Cushing's disease, you have metabolic alkalosis. Usually, this is due to the decrease in potassium associated with the condition. Hypokalemia also leads to metabolic alkalosis, and in pyloric stenosis, you also have vomiting that once again leads to the decrease in gastric acids and decrease in potassium, leading to metabolic alkalosis. Now, in short bowel syndrome, there's usually diarrhea. So patients having short bowel syndrome as a condition could eventually develop metabolic acidosis. Thank you for watching the video, and make sure to subscribe to this channel and keep track of my other videos. The next video actually would be dealing with manifestations of acid-base imbalances.